Okay, so it is 2 minutes after the hour, so I think we're going to get started. And so good afternoon, everyone. Thank you all for joining us today. Welcome to the webinar titled Health Informed Heat Mitigation Case Study of York Region. This webinar is being recorded and will be uploaded to the Greenbelt's YouTube page to be available for those who cannot join us today. My name is Sam Cava, and I'm the manager of the Natural Assets Management Program at the Greenbelt Foundation. The Greenbelt Foundation was established in 2005, and we are the only charitable organization that is solely dedicated to the health and prosperity of Ontario's Greenbelt. We work to ensure that the Greenbelt remains permanent and protected by making investments in its interconnected natural, agricultural, and economic systems. We coordinate, fund, and support activities that bolster the Greenbelt through strategic grants and programs, research and policy initiatives, as well as engagement and outreach activities. At the Foundation, we acknowledge that the land we strive to protect consists of various treaty lands and is the traditional territory of the Anishinaabe, Haudenosaunee, Huron-Wendat, and is now home to many other diverse First Nations, Métis, and Inuit peoples. For generations, Indigenous peoples have lived in harmony with what we refer to as the Greenbelt and continue to be stewards of this land. We express our gratitude for the opportunity to live, learn, and work on this territory. Today's webinar will introduce you to a novel framework that emphasizes the crucial role of greenery cover in protecting people from heat stress and building environmental resilience to climate change. And as you probably would agree, this webinar is quite timely, considering the very warm weather we've experienced this year. At the Foundation, we started funding research on the importance of greenery cover in building resilience to extreme heat a few years ago, with the publication of the 2020 report titled Cooling Corridors, the Role of Green Infrastructure in Building Resilience to Extreme Heat by Dr. Umberto Berardi and his team from the Toronto Metropolitan University. The evidence was very clear that conserving and investing in trees and forests can help manage the health risk impacts of extreme heat days. The groundwork laid by this research was subsequently amplified through extensive studies conducted by Dr. Jeffrey Wilson and Dr. Mohammed Darder from the University of Waterloo, in addition to Dr. Berardi from TMU. Today, you will be hearing from Dr. Wilson and Dr. Darder about their pioneering work communicated in a Greenbelt Foundation report published this past August that was titled Health Informed Heat Mitigation Approach, Case Study of the Regional Municipality of York. And so without further ado, I would like to introduce you to Dr. Jeffrey Wilson and Dr. Mohammed Darder. Dr. Jeffrey Wilson is an assistant professor at the University of Waterloo, School of Environment, Enterprise and Development, and is a leading Canadian expert in sustainability management, working at the interface of economic and environmental research and policy. Dr. Wilson's research specializes in low carbon pathways, corporate social responsibility, sustainability strategy, natural capital accounting, and ecosystem goods and services valuation. Dr. Mohammed Darder is a postdoctoral fellow in the School of Environment, Enterprise and Development at Waterloo as well. He's an assistant professor of building science and earned his PhD degree in building engineering. His research interests include renewable energy, energy modeling, and urban microclimate and health. Dr. Darder is a member of Canada Green Building Council, Indoor Air Quality, Ventilation and Energy Conservation Association, and the International Association of Building Physics Society. After Dr. Wilson's and Dr. Darder's presentation, you will have an opportunity to ask them questions via the Zoom chat. So with all that being said, please take it away, Dr. Wilson.
Thank you, Sam. And I just want to extend a special thank you to the Greenbelt Foundation, who has really been instrumental in supporting this work and not just the current work, but previous work that the research we're presenting today builds on. So want to extend a thank you and just want to really quickly acknowledge Mohammed. So Mohammed and I are going to do the presentation today, and there's going to be a little bit of a awkward because we're going back and forth on the slide turning, but I think we can make it relatively seamless. But want to acknowledge Mohammed, who really carried out the modeling and the bulk of this work. And I just get to be part of the webinar and feel good about myself and possibly take us off the rails. So I'll try to stay on target, but wanted to extend that. And then the last little thank you I want to say is to my friend Gavin, who gave us the title, It's Getting Hot in Here. The study that we're presenting today, it looked at the role of green cover in mitigating impacts of hot temperatures and extreme heat in 2 neighborhoods in York. And we focused on 2 different scenarios. We focused on a typical summer, and we focused on a heat wave event. And the modeling that we've done uses a statistical predictive model. And really, I think we're at the forefront of understanding how hot temperatures and extreme heat impact our communities, and more specifically focusing on the health impacts and the economic costs of those health impacts. This research is part of a broader research agenda, and the broader research is trying to develop a tool for municipalities that demonstrates the health responses and the associated economic benefits that are provided by natural infrastructure. And more specifically, the benefits that are provided by investing in natural infrastructure as a climate resiliency strategy. A very prevalent narrative is that expenditures on natural infrastructure, natural capital, green assets, that these are costs to municipalities. And subsequently, when they're perceived as costs, they're too often neglected in our budgetary and resource allocations decisions, and they're neglected in an environment where municipalities face many, many competing priorities. So the intent of our broader research agenda is to demonstrate the benefits of natural infrastructure investments, to provide evidence and support to municipal planners, policymakers, and those who are looking to enhance and advance natural infrastructure, to provide them support to defend these types of investments and decisions. Before we dive into our study and share with you some of the finding and results, I wanted to tell you a very quick story. I'm a maritimer, so I love telling stories. But I moved to Ontario to take a job at the University of Waterloo in September 2019. And when I did so, maybe you can flip the slide for me, Mohammed, so I know where we're at. When we moved, I sold land that I owned in Nova Scotia. And for those of you who know Nova Scotia, it was on the eastern shore. It was about 85 hectares of land, and I would go there to camp with my boys, and we would fish. And there was this beautiful ridge with old trees. There was lake frontage. There were moose and deer and more black flies in the month of May than you can imagine. And when I sold the land, I sold it for about $600 a hectare. And at that time, $600 a hectare was a reasonable rate for timber resource land on the eastern shore. And the price of the land was based on the perceived value of the timber, not on any of the other value that the land provided. And if you want to switch, Mohammed. And at the same time that I sold my land, there was a JPEG file by an artist named Beeple that sold for $69 million. And what I kept asking myself, is this really more valuable than the land? Mohammed, if you want to switch, just to remind people of the beautiful land I sold. And I'm stealing, and if you want to switch again, Mohammed, I'm stealing the thesis of Mark Carney's recent book. But what he challenged the readers to think about was that shouldn't our priorities and how we assign value be informed by our values. If you switch again, Mohammed, if you look at this image on your screen, in our current economic narrative, the image on your left has value and the image on the right doesn't. So what we put a dollar amount on often comes at the expense of what we don't attach a dollar value to. And so when you're thinking about, from a municipal perspective, when you're thinking about budgets and resource allocation and identifying priorities, and when you think more broadly, how do we influence policy? How do we influence the bookkeeping to reflect that tree canopy cover, riparian zones, naturalized stormwater drainage areas, that these provide benefits and value to a community? And one of the ways that we're attempting to do that is to put a dollar value on health impacts associated with green infrastructure investments to show that these are important and shrewd investments that municipalities should and can be making. So I'm going to jump back into, if you want to switch it, Mohammed, into the core of our presentation now that I've taken you on a little bit of a tangent. If you want to switch, Mohammed, that'd be great. And so the focus of our presentation today is really the fact that globally, this past July was the hottest month on record. And if you look at the climate predictions from Environment Canada and Climate Change, it's going to keep getting hotter and hotter. And it's not just going to get hotter globally, it's getting hotter nationally in Canada, and it's getting hotter in the Toronto region. The frequency of extreme heat events in the Greater Toronto area are predicted to rise to 66 days per year by 2050. And to put that into perspective, what it means that in Canada, there will be over 2 months a year where it's not only unhealthy, but it will be unbearable to be outside for long periods of time. And if you want to switch, Mohammed, and this slide's a little bit dramatic, perhaps. Heat kills, but it's important to recognize that as a climate impact hazard, hot temperatures kill more Canadians than any of the other climate hazards. According to the BC Coroner's Office, during the British Columbia heat dome in 2021, 619 people died. And that heat event lasted only 6 days. Now, when you think about the other climate hazards, so floods, wildfires, storms, these get a lot of attention. And the reason they get so much attention is because of the visible destruction and damage costs to our infrastructure. So our homes, our transportation systems, our electrical grids. Now, hot temperatures also can damage infrastructure, and they result in decreased worker productivity. But I think the real costs are lost lives and the increased burden on our healthcare systems through increased ambulatory calls, emergency department visits, and hospital admissions. So if you want to switch, Mohammed. So in this study, what we attempted to do was estimate environmental and health benefits associated with increasing green cover in 2 residential neighborhoods in York Region with respect to urban thermal behavior, building energy consumption, and health benefits. And I'm going to pass it on to Mohammed, who's going to talk a little bit more detail about the methods and the statistical simulation predictive modeling that we did. And he's also going to share some of the findings with you. So take it away, Mohammed.
Thank you, Jeff. And I'll try to be a little bit precise and not that technical, because it's our work involved the work with the microclimate evaluation and the link to the health outcomes and health productions and health records of the community. So in order to do this, and in order to be objective enough, we build a framework that we want to, if we want to integrate any heat mitigation technique to the urban environment and urban microclimate, and we need to evaluate its impact on the microclimate environment and thus the health outcomes of the community itself, we need to integrate multiple approaches. It's not only a single approach that we need to estimate, but also we need to get some real data from the community. So that's why we built our own approach to test two kinds of heat mitigation techniques, which we focus on tree canopy and ground vegetation cover. Ground vegetation covers means the grass and shrubs and the ground level urban greenery, and the tree canopy enrichments. And we used microclimate modeling in order to measure its impact on the environment itself. And in order to get the sense of health records, we went into the data sets of the community itself. So the health records of each community we investigated, two communities in the York region, and we have daily health records focusing on mortality cases and emergency department visits. And we correlate this, or we link this to the daily weather data in order to reach an understanding or a deep relationship between the environment and the health. What's going on when the heat is exaggerating, and what is the impact on the health records while it's going it's going greater, or it's acting differently. So this is the why we dig into this huge data set that we integrate statistical analysis on, and we did this with the collaboration with Statistics Canada and RGC, the Research Data Center Microdata. Then we have a statistical modeling approach integrated with microclimate simulations and predictions, and we integrate both of them in order to predict the future health records. So what would be the impact of future heat waves, extreme heat, and what we can do to mitigate this extreme heat, and what would be the impact on the health records in the future. So this is briefly what's going on. And then we take this approach to the economic valuation to measure the expected economic benefits out of reducing the energy consumptions of the building, avoiding the productivity losses of the workers, the outdoor workers, and of course the savings expected from the health system, from hospitals and even the premature mortality, the avoided premature mortality rates that expected and related to the enhancements in the microclimate environment. So at the end, we can reach a sustainable decision-making framework that could help the decision makers and stakeholders to evaluate those kind of heat mitigation techniques, and to give the policymakers an evidence-based approach in order to propose and evaluate the urban planning decisions and urban development goals and targets. So our implementation involved the enriching the tree canopy and the enrichment of the ground vegetation cover. And we faced so many questions at this stage. Do you think that we can reach up to an extensive level, or the very great intense level of urban greenery? And actually, it's not a dream. It's actually it's happened. It happened within even that York region itself. So that's why we intend to capture some photos, and it's current photos, by the way. Very few examples there for an intense tree canopy level. So this is what we intend to do, or intend to have within the wall neighborhood. And this is the actions that we implement to the wall neighborhood scale, on the neighborhood scale, to have two levels of implementation: a moderate level of integration of the greenery cover, and an intense level of implementation. As you see, that this is an example of the intense level. So because it's a we always say that it's doable to do it, and it's not that far to achieve the intense level. So what we did actually, and that we can consider a scientific novelty of this project and this work, is to have going back into data set for 17 years of data, of daily data, of both health and weather measurements, from 2003 until 2019. And we dig into this data through different statistical analyses, especially regression analysis, in order to understand, number one, to understand what's going on while the environment is changing, and what would be the impact on the health records. And thus, number two, to predict the health records using the same, and this is the novelty that I meant, using the same behavior of the same community. So we didn't use estimation. We didn't use a generic models. We used specific models for specific communities. So this is the approach that we propose, that our predictions based on real behavior of the community itself. So what we did is published in this paper. So anybody, I'm not going to very technical details about this approach. So you can check this paper for specific methodology, and if you want to know more about the statistical modeling approach that we did. But what I want just to emphasize, that we did this based on the behavior, the local behavior of the community itself. Going into some findings of, first, the microclimate modeling. What happens when we increase the greenery cover? First, with the temperature of the, temperature, the daily outdoor maximum temperature expected during a heat wave. So we investigated so many points of measurement within the two neighborhoods under study, investigating the two level of implementation. So we have the moderate level and intense level. So we investigated this with different locations, different canopy covers or greenery covers. And we reached the graph that you can see, that a maximum of 6 degrees reduction in the maximum temperature can be reached with the implementation of the greenery cover during a heat wave. So 6 temperature after, if you remember slide that Jeff pointed at, that we have like expected 22 days per year of hot days. So maximum temperature reduced by 6 degrees can reduce this number by 60%. So we can reach about 10 days of hot days a year in terms of the maximum temperature or the outdoor temperature, the ambient temperature. And this, of course, impacts the indoor performance, the energy consumption of the buildings, and of course, reflected on the cooling bills afterwards. Also, in order to measure, because temperature itself, it's not accurate representative to the comfort. So the humidex, which means the temperature humidity outdoor comfort index. So it's an index to measure the outdoor comfort. And that's an official index in Canada. So we use this humidex index to represent the outdoor comfort. So what we did is to measure the humidex, because it's not only considered temperature, but also the humidity level outside. So we measure the humidex performance due to our implementations. As you see, the small map refers to the locations that we investigated, and the table refers to the whole spectrum of results for only this neighborhood. But I just want to focus as an example for one result that, for example, this is the daily average humidex for during a heat wave. That this humidex was reduced from 32.7 degrees with the existing condition of the canopy cover to at 28.5 degrees using an intense greenery cover proposal in one of the locations. So this reduction from 32.7 to 28.5, which represents almost 13% reduction in the humidex. Maybe somebody says that it's not that much, but if you know that 30 degrees is a threshold between discomfort and comfort based on the Southern Ontario guidelines and standards of the humidex. So if you know that 28.5 can move the outdoor community from discomfort level to a comfort level or no discomfort level, that's more scientifically, we can now feel that or make a statement that, yes, we can mitigate heat, extreme heat, using some nature-based solutions. And this was reflected by increase of 55% of increase in the tree canopy, for example. So it's just an example. So we have the, actually, I invite you to have a look into the report that have all the technical data and information and the results associated with this work, and all the analysis that's included in the report. So I invite you to look into this report, and you will find it interesting, and you will have the other data included. What this would be the impact on health? So back to the statistical modeling approach that we did, that we have this correlation between daily humidex measures and daily health records. We can predict when the humidex level would change, so we can correlate the real behavior of the health records, and thus we can predict the health records based on the predictions and enhancements in humidex in the future during heat waves. So this is exactly that we did, so that we have some expectations and predictions based on the statistical modeling and environmental modeling approaches that we did during two conditions, during a heat wave and during the normal summer season. That's normal summer day. And we have the implementation of existing tree canopy, and what if we intensify the green recover, all the green recover. So we can see that it's always a reduction in the predicted health records based on enhancements in the outdoor environment. And one of the interesting things that we can notice that the reductions are greater even during the heat wave. So when the extreme heat happens, so we would expect more protection to the community health. So this is one of the very interesting thinks that the nature is working with us, but we have to respect that when we involve some kind of solutions, that nature-based solutions. So during extreme heat, so yes, they provide those solutions can provide further protection. So one of that very interesting things that we really notice in this work. Thank you, Jeff. Please, Jeff, you may go with the economic benefits, and of course I'll be back to continue with any questions.
Thanks, Mohammed. And one of the, I think, creative and novel elements that we added to this report was we attempted to put an economic benefit on the health impact. So we looked at a number of different economic benefits. So of course, we looked at the health benefits, and these included avoided premature mortality, and then what we're calling health system savings. And so this is the expected reduction in daily emergency department visits, hospitalizations, and ambulatory calls, ambulance calls. We also looked in the study at energy savings related to the need for air conditioning and other cooling related devices. And we looked at avoided losses in worker productivity. So I think one of the key messages when we're thinking about this in terms of investments in natural infrastructure, we really looked at a small sliver of the potential economic benefits. We looked at economic benefits associated with increasing canopy cover and the impact that that has on temperature. But trees and canopy cover provide other benefits as well that we don't typically value. So there's a biodiversity function, there's a function in air quality and water and all sorts of other ecosystems, goods and service benefits. And we really just focused on a sliver. The other thing I want to say around the economic benefits is, it's important that when we did this, it's really, an early attempt. So I think as we move forward, there are opportunities to increase the, statistical and scientific validity of our results. So in this case, we primarily relied on, so we knew the health impact, but in terms of assigning the monetary value, we relied on existing information sources. If you want to flip it, Mohammed, that'd be great. So really, if I'm just going to boil it down to, I think, two key contributions from the research. I mean, one, we clearly demonstrate that mitigating exposure to hot temperatures provides health benefits. Prevents premature mortality, and again, reduces costs to the healthcare system. The one area moving forward that I think will get a lot of attention is around worker productivity. So not sure how many caught it in the media, but their Ontario government is looking at the thresholds for outdoor workers and when they're not able to work, or the amount of breaks you need to provide, et cetera, et cetera. And so that's one area where I think you're going to see a fair bit of attention and understanding that that will have a large impact on economic productivity. And then I guess the other real contribution of this research, I think, is, and moving forward, ideally, we're going to be turning this into sort of a web-based interface tool that municipalities can use. But I think simply the report and the results provide strong evidence and rationale for municipalities that are looking to invest in green infrastructure. On the last slide, or the next slide, I just want to talk about what's next and where we're going with this work. So I think one of the exciting things we're doing, and this again is going to be in conjunction with the Greenbelt Foundation, but we're looking at including other climate hazards. So really we focus so far on hot temperatures and extreme heat, but because of the model, which we've already built in terms of the historical weather data that we have. So we have over 17 years of weather data, and then we have the health data. we can also start to look at what we're calling flood and storm. So we'll look at intense rainfall events and long periods of rainfall events, but also wind and the impacts that those have on health and the subsequent benefits. One of the other areas where we're expanding the model is around the health category. So we can look at health or hospital admissions by category, and we can begin to see impacts. So for example, in terms of mental health, one of the areas in a project with Nova Scotia that they've been really keen on is impact on maternal child health. And then, of course, one of the other, which again was work that had been started with the Greenbelt Foundation, where we've been looking at physical activity and the costs of physical inactivity related to green space and natural infrastructure. And then I would say, and I've alluded to this before, but I think in terms of the economic benefits, we can absolutely make improvements there. And then beginning, and we have done this to some extent, looking at the impacts on specific socio-demographic groupings, but we can take that a step further. So that's where we see the work going. And I'm really excited for your questions and hoping at some point, potentially we can work with your municipality as well. So thank you very much. And acknowledgements. Obviously, I've said thank you to the Greenbelt Foundation, but we did have a lot of other support to carry out this work. So Statistics Canada, and more specifically, access to the RDC lab, Health Canada, the CRDCN network, York Region, who was a fantastic community partner, and MyTax, who provided some funding for the project as well. So thank you.
Thank you, Dr. Wilson. Thank you, Dr. Dardier. I know that when you guys presented the findings to us at the Greenbelt Foundation, we were quite taken aback by the results and really excited about spreading the word about this really, really important research. And we look forward to working with the both of you in the future research that you just alluded to. So I did mention two things. I included the link to the report in the chat in case you have not seen that as yet. Also, feel free to start typing your questions in the chat for Dr. Wilson and Dr. Dardier, and I can relay those questions to them. But I thought maybe kind of to get the ball rolling, and hopefully I'm not stealing someone's question. I have a question myself, and I'm wondering if, and you just alluded to this, Dr. Wilson, briefly, but I know that in order to implement this research, this framework, the idea is to create like a municipal tool to implement the framework. So I'm wondering if maybe you can expand a little bit more on what that tool might look like, and any maybe expected barriers that you might predict in implementing something like this at a municipality.
Yeah, I'll jump in, and then Mohammed can add some detail. But essentially, we see this as a decision support tool, and more specifically, where an individual working at a municipality could look at different scenarios. So if you make this type of investment, so I'm going to stick with green cover, but there are other interventions around reducing exposure to hot temperatures and extreme heat that you could include. But let's say we're looking at increasing green cover, you could put in different scenarios. So if we increase the canopy cover in neighborhood X by 10%, what are the implications of that in terms of reducing health impacts? So the idea, and again, we wouldn't just look at hot temperatures, it would consider other climate hazards as well, but would really be a decision support tool to help guide investment, but also understand the possible returns on investment. And even one of the exciting things I think about the research is that you can, we've done this or can do this for municipalities across Canada, but you can focus in at a neighborhood level. So you can begin to identify priority neighborhoods and then, potentially look at which neighborhoods are the most strategic, depending on your priorities to make investment in. So Mohammed, do you want to add anything?
Just about the potential of this tool, that yes, it can include different like climate hazards, and also it can include different heat mitigation techniques that it could be proposed. So this is one of the flexibility approaches that we have in our modeling, that it can accept any other solutions or proposals that can be done. Also, talking to the challenges that we are thinking about it now, that the health approach, as I said, that it's a little bit specific to our community. So what could we do to have a tool, or we need to, for all the municipalities to make use of it? So now we are developing a different approach that it's based on the urban level of the community itself. Because we noticed this with our statistical modeling, that the community behaves differently when the urban level is different, and similarly when the urban level is similar or close to each other. So the large cities can have a separate model for health statistical modeling approach, and medium and small scale and even rural communities. And this is our approach to investigate this kind of, or provide some kind of solutions to provide both benefits of our modeling technique and make it general a little bit to for all the municipalities to make use of our for this tool.
Thank you so much. Yeah, that's fantastic. So I don't see any questions in the chat. But so I have one more question on my end, and maybe this will answer some of the attendees' burning questions as well. But and this might be out of scope, but you know, kind of, we expect trees themselves to be impacted by climate change. So like, we expect trees to be a little bit more stressed and therefore a little bit more susceptible to insects, to diseases, which could then in turn affect their heat mitigation services, hypothetically. So I guess my question to you is, has this been a consideration in your research, or have you heard of concurrent research being done to address that? How could we ensure that our trees remain healthy enough, and greenery cover remain healthy enough to deliver these really, really important services?
May I jump in, Jeff?
Yes, Mohammed, thank you.
Of course, and you, of course, I'll leave the floor to you after. I can add also some points that what about the wildfire, the management, and what about the for example, if there is a problem with a storm and the trees would be the cause of power outage, what about the lifespan of the trees? What about some species that wouldn't be helpful, for example, solar absorptance or solar blockage, or any other problems and issues. So all of these problems and issues are included in the risk mitigation, risk management plan that we are planning now. It's not only about mitigation of specific causes. It's a holistic microclimate management or risk management, environmental risk management plan. So yes, in the next step, we are aware about these problems that we face, and the project that should involve. And as I said, it wouldn't be like a single mitigation technique. It would be a holistic environmental risk management plan, including all the dangers, risks, and also the benefits. Jeff, please.
Yeah, I'll just talk a little bit. There were two interesting events that happened this summer within the last 4 or 5 months. One was in Quebec and Montreal, where it got the most attention, but there was the storm event knocked a whole bunch of trees down, and they went on power lines and disrupted, had a huge impact on the electrical grid. And one of the outcomes of that, or one of the initial reactions to that, was we have to essentially cut back our urban canopy cover. So that was a climate change related event, which can have a negative ripple on other investments that are being made to address climate change. And so I think, I'm going off on tangents here, but since there's no questions, I'll just go. Another area where you're seeing this, and through some of the other work I've done, the wildfires. So you have a lot of, these projects that maybe have been set aside for carbon sequestration or some sort of carbon credit scheme. And what do you do about the wildfires? And how do you bring that into your decision making? And I think we are already in a very complex time, because we don't have a great understanding of, and especially at the municipal level, of the impacts from climate change. And then, of course, we have the cumulative impacts of different events, and we have cascading impacts. So absolutely think it's a challenging time. And in some respects, from my mind, that's just more reason to double down on increasing the climate resiliency of your community, and making sure that you're making natural infrastructure investments now, making sure that you're making good decisions especially decisions that have a long-lasting impact. So if you're making development decisions, or if you're investing in certain technologies, or if you're replacing infrastructure, making sure you're doing so with a long-term mindset, because once you make those investments, they're now in place. And I guess the other point I wanted to make at some time, and again, if there's questions, interrupt me, but this specific paper is focused. Oh, question?
There is a question, but finish your thought, but there is one more question actually from the audience.
Okay, perfect, because I'll go on and take this one elsewhere. But I did want to say two things we've done in a study that built on this work, and it was done in Nova Scotia, that I think is interesting. Is a lot of the work we've done so far is focused on urban applications. And so they were interested in rural applications. And of course, in this case, in rural areas, increasing tree canopy cover may not necessarily be the priority. So they wanted to look at other interventions. And so they were looking at the impact that cooling stations could have. So I think that was interesting. And I guess the point I want to make is, it's not just an urban tool. It does have relevance in rural communities. And then I think the second important thing, and Mohammed sort of talked about this, but there are other interventions that can be assessed using the model. And so Sam, take it away.
Great, yeah, thank you. We have a really great question. Attendee just thanking you for your research, and she wants to know, how could the health impacts of green cover be operationalized beyond just emergency room visits? For example, for mental health or physical activity, what methods could be used to study the link? Does it involve working more closely with physicians and health clinics to assess mental health status, et cetera, to get an idea of physical activity?
Yeah, actually, it's beyond emergency department visits. Actually, we have some of the results now associated with ambulatory calls, daily ambulance calls. Also, the specific metrics of mortality rates, not only all calls, mortality rates, hospitalization, and days of stay. So we have multiple metrics. We have other part of the work specified with the mental health. I believe Jeff could say more about it, about mental health metrics and the green spaces within the city. Also all the data that could be reached within the microdata, the daily health records, yes, can be approached. And actually, we are working on this. and I believe it will be published very soon. Jeff, you
And
may add. Yes, please.
yeah, I'll add. So the mental health is tricky. So two areas where we can at least get a glimpse at the potential benefits. So one is with hospital admissions, for example, cause of hospital admission. So in that sense, we can capture that. But one of the areas that's had a lot of attention, especially coming out of the pandemic, is what is the role of green space in improving mental health and well-being. And there's been a lot of research around that. And there are different studies that have been done, but one of the numbers I know off the top of my head, there's sort of this idea that if you spend 30 minutes per week in green space, it reduces population prevalence of depression by 7%. So we've attempted in some other work we've done looking at the value of green space where we didn't do direct, we didn't do a direct study. What we did was we used other studies to try to understand the mental health benefits. And I'll just give you an example. So we worked in a study with the city of Toronto, and they were really looking at the EGS value of parks and green spaces. And one of the categories that we considered in the analysis, so it was primarily focused on the typical ecosystems, goods and service values, but we did look at the mental health contribution as well. And the way we attempted to do it was they had, through some data that they collected, they had an estimate of number of users, so park space access, and then time in park. So we attempted to do that to estimate the amount of time spent in parks. And the other interesting thing about that work, and it was data that they got from Environics, but you could look at other variables between, and you could distinguish between park users and non-park users. So that's an example of one way you could try to tease that out. Now, one of the challenges with any of the economic valuation, and this is going to go to ecosystems, goods and services, and this is really around the health impacts, is you're making assumptions. You're making a lot of assumptions, and I think it's key in your work that you're very transparent about the assumptions that you're making, because people can potentially attack the approach you've taken. So my philosophy is you're open, you're transparent. You say, here are the numbers we're using. Here's how we did the valuation exercise. If you're not happy, substitute in your own numbers and come, and draw your conclusions based on numbers that you're more comfortable with. So problematic, but at the same time, I do think it's important that we begin to highlight that there is value that we often don't consider. Can I keep going, Sam, around physical activity? Should I stop?
We have 5 minutes, so please continue.
Okay, so the other category you were mentioned in that question was around physical activity. Want to be very clear here that if you're looking at the benefits of physical activity, that relationship between physical activity and mental health is all connected. But again, there's been a lot of research looking at how parks and time in parks and parks access increases levels of physical activity. So we've done some other studies where we've attempted to put a value on that. Again, in all cases, we've used academic literature, and we haven't done any kind of direct, I don't know if survey data or observation data or other forms of analysis, but there is a very large body of literature which looks at the value of green space and parks in terms of increasing likelihood of physical activity.
Fantastic. Thank you so much. I don't see any further questions in the chat. So maybe this is a good time to end the webinar. So I just want to give my sincere thanks to all attendees today. Thank you so much for joining us. And to Dr. Wilson and Dr. Dardir, thank you so much for your really amazing and impactful work. And like I said, the Greenbelt looks forward to working with the both of you into the future. I put my email in the chat. If you would like to follow up with any additional questions you might have for the researchers, please email me and I can put you in touch. But then other than that, I want to wish you a great rest of the day. And again, thank you so much for joining us today. Have a great day. Bye.
Thanks so much.
Thank you, Sam. Thank you so much.